The thumb is the most important digit on your hand. You lose 40% of the function when you're unable to use it. One cause for thumb pain and disability is arthritis. Dr. James Foley of Redlands Community Hospital explains what causes thumb pain and what treatments are offered to regain full use of the thumb.
In terms of disability, you lose 40% of the function of your hand when you lose your thumb. So it's very important.
We asked Dr. Foley what is the most common cause of thumb pain.
There are many problems that can cause pain or disability in the thumb. One that I'd like to talk about is arthritis at the base of the thumb. This is seen much more commonly in women. It's about 10 to 15 times more common in women as compared with men. And it's a heritable phenomenon, meaning that it's more common in families as arthritis is all over the body. It's also a mechanical phenomenon. What happens is, and the reason we believe it's more common in women is because a ligament is used to stabilize your thumb when you pinch. And this ligament wears out over time, it stretches out. The thumb joint at the base of the thumb here is an inherently unstable joint, meaning it gives us a lot of degrees of freedom of motion. But if that ligament wears out, then the cartilage of the thumb joint will see a lot of stress, and this leads to arthritis. Pain is the #1 complaint, and it's experienced using the thumb, particularly in pinch, what we call lateral pinch. Things like opening jars, turning a key, turning a doorknob. And so people come in and they'll say, my thumb hurts. Every time I do this, and it's right here, sometimes they'll experience swelling as well. We do need to do x-rays to confirm the diagnosis. When somebody says, I have pain here at the base of my thumb, there's a couple other problems that we want to rule out. #1 being what we call decurvaneous tendinitis, which is tendinitis of some tendons that are very close to that location. So it's not a clear-cut diagnosis, always based on history and exam. But again, when somebody is of a certain age group and describes their symptoms a certain way, we can perform certain exam maneuvers that help us come to that diagnosis, and then we confirm it with radiographs.
We asked Dr. Foley what can be done to regain mobility of the thumb.
Options are anti-inflammatory medications, splinting, and sometimes an injection into the joint of cortisone. When those measures fail, then the option is surgery. If somebody's in their 80s and doesn't do a lot of pinching, doesn't do a lot of activity, is retired, is no longer working, they can probably get by with some simple measures. People who place more demands on their thumb are more likely to fail the conservative treatment. Most commonly, there's an operation that where we take out the arthritic bone at the base of the thumb. We stabilize or reconstruct that ligament that gets stretched out by taking a tendon from the forearm, and we use the remainder of that tendon and ball it up as an anchovy and place it where that bone came from as a spacer. Recovery takes about 6 weeks to 3 months. Probably greater than 90% of people in most studies are happy with the operation, and their grip strength improves about 93%, and their pinch strength 65%. It's a common operation because it's a successful operation.